So, hello. Today I'm going to explain first Assalamu alaikum and hello. Today I'm going to explain the instruments that are used for handling flaps. In another video, I will explain. I already wrote it down. The types of knives that are used for the incision. These are the periodontal knives and the surgical blades, also called lancets. The periodontal knives can be divided into two types of knives. These are the Kirkland knives and the interdental knives. Especially both of them used for the gingivectomy, and the interdental knives is also used for the just forgot modified Wedgman flap. So now we have here the periosteal elevators that are used to remove to reflect the flap that is made after the incision has been done. So how it looks like, I will draw it now. But first of all, it has two sides. It has the concave side and a convex side. The concave side is sharp. This is towards the tooth or the bone. And the convex side is towards the flap. To avoid any laceration. And these elevators, they are spoon-shaped instruments, okay? As I said, sharp cutting surface and a round edge. So they look like, we have here, this is like the handle. Then we have here the shank, okay? Then we have here like a spoon-shaped instrument, which is very small, okay? This is much bigger than the other one. So this is the small size and this is the large size. This here, the large one, reflects the flap. And this one opens the papilla. Okay? So, because it is not useful to use the large one for the papilla, it can lead to laceration. So, just to remember, the pointed end one is used for the interdental papilla. The broad end is used to elevate the tissues to reflect the flap. So, we have also another type of elevator that is specially for the papilla, for the interdental papilla. This is called Boozer Periosteal elevator, and the end looks like this. Okay, it has here, this is large size. Here we have a much smaller size. So these are the periosteal elevators that are used to reflect the flap and to open the papilla. Now we have also needle holders. Why do we need needle holders? The needle holders, when you look at it, it looks like a scissor. It is used to to suture the flap at the desired position. Okay? So we have one type of needle holder, which is called Castro Viejo needle holder. Castro Viejo needle holder. Sorry. This is used for delicate techniques that require quick release and grasp of the suture. So it looks like here like a scissor. Okay. So yeah, this is used for delicate techniques. So this is actually, yeah, instruments for periodontal flaps. This is actually the periosteal elevators and the needle holders that we have. We have also instruments for bone removal. These are the bone chisels. Whenever we have axes, we have these bone chisels. We have two types, the oxenbind chisel and the back action chisel. And the oxenbind chisel is used with a push motion, and the back action comes from the word back, is used for the pull motion. And the oxenbind chisel looks like yeah, it has, both have like quite different appearance. Can say this one here goes thinner and narrow. Here's the shank. So they have here like an and, two concave sides. Yeah, my. Okay. So we have two types here, the oxenbein chisel and the back action chisel. Okay. The oxenbein chisel is used for large bone removal. For example, as torus removal or bone morphology. Okay, a back action chisel is used for crown lengthening. These are used if we have a permitted axis. For reduced or limited access, we use bone files, or also called periodontal files. We have the Sugarman bone file, the Schlugerman, and the Schluger bone file. The Sugarman bone file is straight, and the Schluger bone file is angled. The main difference between these chisels and files is the accessibility. We have accessibility and opened permitted accessibility with the chisels, and we have a limited reduced accessibility with the periodontal files. So here we use surgical burrs with it, the files at low speeds, and adequate rinsing with sterile physiological saline. So we can go into the limited accessibility and remove the bone. So we have here the chisels, and we have a second type. We have here the Sugarman bone file, and Schluger bone file. Okay? The Sugerman bone file is straight. It's like straight here. The Sugerman bone file is angled. Okay. So these are it till now. We have the oxenbine chisel and the bone file. And for handling flaps, we have the periosteal elevators and the needle holders. So if you have any question, please write me and I will answer hopefully in the comments below. Thank you.